Hey everyone, Bethesda Spine and Posture wants you to know about cervical disc herniation. You know that feeling when your neck hurts so bad it shoots pain down your arm? That could be a herniated disc. Here are the top 10 ways to address cervical disc herniation, from the simplest to the most complex. First up is the most basic step rest and activity modification. When you first experience pain from a herniated disc, your body is telling you something is wrong. Give your neck a break from activities that exacerbate the pain, so stop lifting heavy weights or spending hours hunched over your computer. Gentle movements and maintaining good posture are super important to reduce pressure on the disc. Cryotherapy can reduce swelling, inflammation, and pain. Applying ice to the affected area for 20 minutes at a time, several times a day, can make a big difference. Over-the-counter options like ibuprofen may be helpful for mild to moderate pain and inflammation. In more severe cases, potentially addictive prescription pain relievers and muscle relaxers might be necessary. But remember, these are usually for short-term use and come with potential side effects, so tread carefully. Think of physical therapy as retraining your body to move efficiently and without pain. A physical therapist can teach you specific exercises to strengthen your neck muscles, traction to improve mobility, and massage to reduce muscle tension. All of these will help reduce pain. Chiropractic care can be very effective for herniated discs, but gentle methods should be considered, and only a licensed, experienced chiropractor should manage such a condition. Not all chiropractic techniques are appropriate for herniated discs. Have a frank and direct conversation with your chiropractor before you get adjusted. Acupuncture involves inserting thin needles into specific points on the body. The idea is that acupuncture stimulates the body's natural healing processes and can help manage pain and muscle tension. A trained, licensed acupuncturist can work wonders. In some cases, your doctor might prescribe a short course of oral steroids to tackle inflammation. These medications work by suppressing the immune system's inflammatory response, which can provide significant pain relief. They're typically prescribed for a limited time to manage acute pain and inflammation. If oral steroids aren't providing sufficient relief, your doctor might recommend epidural steroid injections. This involves injecting corticosteroids directly near the affected nerve root in your spine. These injections can provide significant relief, especially in cases where the pain radiates down the arm. These spinal interventions should be done by a board-certified pain management physician, like a fellowship-trained anesthesiologist or physical medicine doctor. They're often used in conjunction with other treatments, like chiropractic and physical therapy. If conservative treatments haven't provided lasting relief, your doctor might discuss minimally invasive procedures. One option is percutaneous discectomy, which involves using a needle to remove a small portion of the herniated disc. Another is nucleoplasty, a technique that uses radiofrequency energy to shrink the herniated part of the disc. Surgery is typically considered a last resort when other treatments have failed to provide adequate relief. One common surgical procedure is anterior cervical discectomy and fusion, ACDF, where the herniated disc is removed and the vertebrae are fused together. Another option is artificial disc replacement, ADR, which replaces the damaged disc with an artificial one. Consult multiple surgeons before considering this option. You should have a recent MRI and results from a nerve conduction studies when you meet with your surgeon. Beware if your surgeon says you don't need these diagnostic tests. So there you have it, 10 treatment options for cervical disc herniation. It's important to remember that everyone's journey is different. Most cases start with conservative treatments like rest, ice, and chiropractic physical therapy. If those don't provide lasting relief, your doctor might recommend injections, or in some cases, surgery. Bethesda Spine and Posture is here to help you utilize least invasive therapies first and graduate to more invasive treatments as needed.